Hi there viewers. Welcome to our channel. Every health condition you are dealing with, especially cancer, has its prognosis. So, what is the prognosis for bladder cancer, and how fatal is it? First, let's define what the term prognosis means. A prognosis is the doctor's best educated guess of how cancer will affect someone and how they would respond to treatments and medical interventions. Therefore, it is normal for a person with bladder cancer to have so many unanswered questions about how it will affect their health and questions about the chance of survival. The doctor may not give you a 100% prognosis because this prognosis depends on so many factors. It requires a lot of knowledge and familiarity with a person's medical history and understanding the type and the advancement of cancer. The doctor's treatments and how the person responds play a big role in determining the prognosis. Besides doctors' deep research and knowledge about cancer and the patient's medical history, the doctors refer to the survival statistics to determine a patient's prognosis. The prognosis is different for each type of bladder cancer. So, the following are some of the main prognostic and predictive factors for bladder cancer. Number 1. Low-grade bladder cancer. This is when the cancer does not grow into the muscle layer of the bladder wall and does not spread to other parts of the body. This type of cancer tends to have a good prognosis than high-grade bladder cancer that has a higher risk of spreading to other organs, resulting in a poorer prognosis. These types of tumors are on the surface of the inner bladder lining, and in this case, cancer cells look much like normal bladder cells. This is why these tumors have a favorable prognosis. Number 2. How deep a tumor is and what stage it is at. For example, if the tumor has grown into the bladder wall, it is a crucial prognostic factor that your doctor depends on. Therefore, the prognosis is less favorable when the tumor has grown into the bladder wall. Another prognostic factor is how advanced bladder cancer is, which means if cancer has spread beyond the bladder into other body organs, especially lymph nodes, the body has a poorer prognosis. The prognosis for this cancer depends on so many factors. Some of them are the treatment options that your specialist uses to treat the cancer. So, what are some treatment options for bladder cancer that your doctor would use to treat cancer or stop its growth? Some treatment options for bladder cancer may include: Number 1. Transurethral resection of a bladder tumor. The purpose of this procedure is to examine the bladder and remove the tumor. After removing the tumor tissue, the pathologist examines it to determine the stage and grade of cancer. Number 2. Intravesical therapy. This is when medications are placed in the bladder to destroy cancer cells. The two main medications used in this treatment are bacil-calmette-guerin, which is used to kill cancer cells on the bladder lining, and mitomycin C. This medication is an anti-cancer drug that has been proven to decrease the number of recurrences of tumors by up to 50%. Number 3. Chemotherapy. This treatment is mostly used when the bladder cancer has spread beyond the bladder to other organs and tissue. Number 4. Surgery. The surgery is performed when the bladder tumors continue to the extent that it invades the muscle wall of the bladder. This is when the urologist recommends surgery to completely remove the bladder so that cancer doesn't spread any further. Now it is your turn. What else can you do to decrease the risk of developing bladder cancer? Please share your experience in the comments below. Please don't forget to like and subscribe to our channel. Thank you.